So good morning, everyone. I'm really happy to be here with you today, although I'll prefer to be there in Athens. I will briefly share with you some, I would say that some learning experience that we have been developing in the past two projects that we have been working in. But firstly, I would like to share with you this view, and I'm sorry for being a bit theoretical in terms of education, but I'm really interested in health professionals education, and I spend a lot of time thinking and studying about it. And one interesting thing, and this is a really old paper from '99 that says that a lot of times academics, when it comes to teaching, they go a lot through their opinion and not so much about evidence base. When we translate this to the clinical setting, we understand that physicians, nurses, pharmacists, everyone, they apply the clinical guidance to their work. But when we speak about education, they suddenly transform in other person that goes for the empirical experience, which is fine and is also important. But actually education is a science and should be studied as it. So next slide, please. What we would like to have is something that is opinion-based, but also evidence-based. So a balance between what we think is right, what is our instinct, or also our imagination, our creativity, but also what is scientifically proved as being something that works with the educational purposes. So I would say that we need to select a theoretical framework, adapt to the target, be guided by the target needs, and I'll share with you something that we have done in previous projects. Also be creative and innovative, sure, but also ensure that there's a continuous quality improvement process going on. What happened is that the educational innovations tend to be crystallized in time. People tend to grab some innovation and never let it go. So we really need to be flexible in terms of our understanding of pedagogical needs, and also bear in mind that society changes also affect the way people learn. And we should have that in our mind when we are creating some educational programs. Next slide, please. So I'll share with you something that we have done for Expand DH. I see that most of you are familiar what Expand DH was. So the aim was to empowering individuals and organizations to explore interoperable digital health solutions. And we wanted to mobilize and build capacity. And this capacity building was done through the creation of some educational materials. Next slide, please. So we wanted to ensure that the relevant stakeholders have the knowledge they need to apply to the adoption. Actually, it was education for adoption to help the organizations to move forward in their readiness to adopt the format. Next slide, please. So what we have done in terms of education, not only for the health professionals, but today I'm focusing on health professionals, we went to them and asked them how they would like to learn. And that's something that we don't do often to our trainees, even in undergrad or postgrad, to ask them, how would you like to learn? Because we know that they might be different among different people, but also might be different, and we do understand that in the academia among different generations. So the way people used to learn is not effective anymore in new Z generation and so on. So we asked them how they would like to learn, and they, quite surprising enough, they didn't answer something new. They answered the old methods like webinars, case discussions, workshops, learn from best practices. So we didn't see any, probably we asked the wrong question, or we didn't ask enough, because we would like also to know how long are you able to spend on learning per day. It can be less than half an hour. It can be like 10 minutes while I'm in the car. So, but I think we have done something that is interesting enough, which is asking them first, how do you like to learn? Next slide, please. And with this information, we created 2 webinars and a leaflet for the healthcare professionals. We created all other materials to other stakeholders like vendors, managers, and caregivers, and also citizens and patients. But when we created this leaflet for the healthcare professionals, we tried to focus on being short and direct, avoid technical details that won't be suitable for understanding to common healthcare professional. Focus on the clinical practice relevance. Why this mattered to me? This was the question that we wanted to ask to answer in all our materials. And also highlighting the benefits for the patients, because often when we talk about digital for people from the clinical world, that they are not familiar and they don't want to listen to us because they think that we will be discussing some algorithms, some really complex things. When we bring the focus of our discussion to patients, to patient safety, to quality of care, everybody will listen to us, because then we find the common ground, we find the common goals that we have for our work. So this is a really good place to start with, focusing on the patient. Another project that is still going on is the AMR Educare. In this project, we were developing some educational materials for healthcare professionals about antimicrobial stewardship. Next slide, please. The goal of this project was to improve the prescription management, waste management around antibiotics, antimicrobials. The program created an online course based on an educational platform like Turio, and have different pathways. And that's also interesting, to be directed to the use of each professional group. So a pathway to medical doctors, pharmacists, nurses, and managers. Next slide, please. We used the framework of the AME, Association for Medical Education in Europe, considered the different learning styles. So we created materials that were different, some written, but the same materials were written or in video or in infographics, so people could choose their favorite way of learning. We used also quizzes to increase learning, spaced repetition, recall from previous learning at longer intervals, and also a question bank that could provide immediate feedback. These strategies are well-known strategies to increase retention and learning. But as we know, to have the knowledge is not enough for action. So we wanted really to translate knowledge into action, into different practical behavior in managing antimicrobials. So we introduced this behavioral change theoretical model that we borrowed from psychology, and also the digital tools that we can use to promote behavioral change, such as telemonitoring, clinical decision support systems, and others. So we try to combine these strategies to make knowledge effective. And something that I would like to highlight today is that it's not enough to transfer knowledge. We really need to translate knowledge into action, knowledge into adoption, knowledge into something that is concrete and real. Yeah, thank you very much.
Thank you, Juliana.